Hello, my name is Maya. I'm the team lead for the Women's Health Physiotherapy Service here in Swansea Bay University Health Board. This video will take you through some basic steps on how to make your bladder behave better. There are the different types of urinary incontinence. There are two types, but many women experience both types, which is then termed as mixed urinary incontinence. Stress urinary incontinence is when you have a sudden extra pressure on the bladder, for example, when you cough, sneeze, or laugh, causing you to leak urine. Looking at the diagram on the left, you can see an image of a healthy, well-functioning pelvic floor muscle, which will squeeze the urethra shut to stop any leakage when exposed to sudden force on it. In the diagram on the right, you can see a weak pelvic floor muscle. When you experience extra pressure on the bladder, the pelvic floor is unable to squeeze the urethra shut. This is when leakage of urine occurs. These approaches are described in more detail in other videos. Urgency is when you have a sudden intense need to pass urine and you will have to rush to get to the toilet. When you don't get to the toilet in time and you leak, this is then called urgent continence. This is often associated with overactive bladder syndrome. In a normal bladder, as it fills with urine, the walls of the bladder stretch. This sends signal to the brain, which tells the bladder it needs to empty. The person then makes a conscious decision to find a toilet and empty their bladder. However, with an overactive bladder, the bladder gets inappropriate signals to empty before it's fully filled. You then respond to that signal, which over a time will result in you emptying your bladder more frequently. This becomes reinforced by certain behaviors such as emptying just in case, reducing fluid intake, an immediate response to empty with the initial urge to avoid accidents. Because you're responding to the inappropriate signal, this becomes a vicious circle. The aim of the treatment is to try and improve your ability to control your bladder rather than your bladder controlling you. However, if you leak without any control or sense of needing to go, you may need a different management strategy. Please seek help from your women's health physiotherapist or other relevant healthcare professionals. To manage urgent incontinence, there are two things to consider. One is fluid intake and the other is bladder drill or training. Of women will change their behavior when they have experienced urinary incontinence. This may include reducing their fluid intake. It is important that you drink plenty of fluids, at least 1.5 to 2 litres per day, even if you're having problems with bladder control. The chart shows you examples of good fluids on the right and known bladder stimulants on the left. By drinking less of the bladder stimulants, it may well help your symptoms significantly. The aim of bladder retraining is to increase the time interval between emptying your bladder and increase the volume of urine your bladder is capable of holding. This is to be carried out when at home, but as you improve control of your bladder, your confidence will increase when you're out and about. When you feel the urge to wee, you need to try and hold off and wait for the urge to pass before emptying your bladder. There are different methods to help you do this. You may find one or all of these helpful. Try sitting and waiting for the urge to pass. Squeeze your pelvic floor or distract yourself. You may feel discomfort initially as your bladder adapts, and you may experience some leakage, but don't let that stop you continuing with the training. Persevere with the strategy. It may take several months to see changes.